cancer vaccines are not necessarily a new concept. We've thought about, given the success of vaccines in, treating infectious disease, really the greatest kind of public health advance of the 20th century, can we then deploy that same approach to treating cancer? And I would say that initial attempts, so what I'm talking about, 1970s, 80s, 90s, and even in the early 2000s, vaccines didn't work as well against cancer as against infectious disease. We've now, though, I would say two major advances that have made cancer vaccines much, much more promising. So the two advances are one, the development of mRNA vaccines, which are much more immunogenic. That is, they produce more robust immune responses. And then the second is our improvements in precision medicine, our improvements in DNA sequencing that allow us to develop more personalized vaccines. So historically, vaccines were just protein based, and they were targeting just things on the surface of tumor cells, and it was really a one size fits all approach. And that hasn't been a very productive strategy. Where the trend is moving now is using mRNA vaccines and even making personalized vaccines. That is, doing comprehensive genomic sequencing on a given tumor, predicting what are the mutations of a tumor that are most likely to be recognized by the immune system, and then developing a personalized vaccine against those specific alterations. And so that approach has already shown some preliminary success in lung cancer. And it's also shown preliminary success in melanoma, such that it's received breakthrough therapy designation for melanoma. I anticipate that that type of strategy is going to then expand to non-small cell lung cancer. The question is going to be, how do we, what's the right time to deploy it, and like at what point, right? So vaccines by themselves, right? If a cancer is growing, I don't think a vaccine by itself is going to be the ideal strategy. It's going to be more used in combination, especially if someone's, where we use a targeted therapy like a RET targeted therapy, and someone has kind of minimal disease at that point, a vaccine may be beneficial at that point in time, really, to stave off, eventual growth. So treating the cancer when there's more microscopic disease. Currently the clinical trials that are ongoing of many of our mRNA vaccines are currently positioned for patients with stage 2 and stage 3 disease. But there is intense research trying to broaden that and take that into the stage 4 setting. So I'd say more to come there, because I do think that the technologies are evolving at a rapid pace.